Actually, when some of my boys were younger, there was this television show and they had the song. And they said, this is the song that doesn't end, 'cause it goes on and on, my friend. Some people started singing it, not knowing what it was, and we'll continue singing it forever just because this is the song that 2020 feels like the week, the month, the year that doesn't end. And the first 6 months have been such that we've not known that there was something else that could be as dramatic, as powerful, as impacting as what we had just experienced. And we continue to have things to pile on. And so in as much as we began the year trying to do the work to make sure that we pull together the coalitions to expand Medicaid so we wouldn't be one of the 13 states in the union who haven't created that access to the healing touch for people in our community, and partnering with the United Church of Christ to do that, to partner with organizers at Jobs with Justice and Action St. Louis to do that. But then, of course, we're faced with a very real health crisis in March. And then we have to find ourselves sheltering in place. And then, of course, we began to wrestle again with the extrajudicial killing of Black people all over the United States of America, most typified in the 8 minutes and 46 seconds that many of us spent watching the very life being choked out of George Floyd. And so these have been the challenges that we've been called to make sure that we meet the moment. 2014, in the middle of the Ferguson uprising, what we saw was a conservative, philanthropic response, really driven by a lot of our corporate leaders in this community who are generally very charitable and invest deeply in social service programs, making sure that delivery of training or education or after-school supports are there for our community. And this is really important. Quite frankly, though, one of the things we know is that the government is always going to be the lead payer when it comes to service programs. Indeed, philanthropy comes nowhere close to supporting those charitable efforts. So this time, our focus is to make sure that we're investing deeply enough in social change programs, organizing, advocacy, public policy change. Because when we invest there, we've come to know, based on studies by the National Committee for Responsive Philanthropy and others, that when you invest $1 in community engaged strategies and organizing and advocacy, you have the capacity to return $115 in government support, because the power of the people as organized and mobilized can change how the government allocates dollars. We have a remarkable example here. Over the course of the last 2 years of the Close the Workhouse campaign, we've seen an allocation of $16 million to an outdated, outmoded workhouse go down to $8 million in a 2-year campaign period. Now, that's not the closure that organizers are calling for, that organizers are rightly demanding, but it is a reallocation of resources that campaign was able to get done because it did public education, it did the direct legislative work, and it's mobilizing community and narrative. See, in April, we're able to partner with the Robert Wood Johnson Foundation to establish a $2.2 million fund specifically focused on investing in Black-led social service and social change organizations in the St. Louis region who are responding to COVID-19 and its impacts. Separately, launched in June, a $2 million racial healing fund for the St. Louis metropolitan region. And we launched that initially with 10 funding partners with Forward Through Ferguson. It will invest very specifically in healing individual and community trauma for organizers and activists, and invest in shifting the conditions that create that trauma. And that's a different response than deciding, as many did in 2014 and 15, that writing big checks to a couple of Black-led organizations that provide social services would get us out of this challenge. One thing I like to say to people about the year 2020 that many don't pay attention to, but it's critical for us at Deaconess, is that 2020 is the first year in American history where the majority of children under the age of 18 are children of color. So for our focus on child well-being, for our focus on civic commitment to children and youth, 2020 is absolutely critical because it means that we have to center equity in all our conversations if we're talking about children. It means that we have to make sure we count every child in the census because they will be the ones coming of age over the course of the next 10 years. And it means when we vote, we need to vote thinking about not just our children, but all children, and especially children of color. So our mission is more palpable, more important right now than ever before. And I'm counting on the next 6 months being as powerful as the first 6 months were challenging. Deaconess Foundation's board of Deaconess Center for Child Wellbeing, our staff, the volunteers who make this place and this mission work are absolutely honored, excited, and delighted to be receiving the Salute to Excellence Health Advocacy Organization of the Year Award.